I'm Dr. Nirav Goyal. I'm head of liver transplant and HPV surgery at Indraprastha Apollo Hospital, New Delhi. I'll be talking on hepatitis, which is a scourge which is there present in our society. And this hepatitis may occur from several reasons. And I will take you through the reasons for hepatitis, how to manage it, how to deal with it, and what are the cures and curative treatments available. So the first question which has been put up is what exactly is hepatitis and what are the types of hepatitis infections which we come across. Now, hepatitis is defined as an inflammatory process of the liver which may result from infectious diseases or other causes. This condition, it can be self-limiting or it may progress to fibrosis, depends on what type of hepatitis infection one has got. And sometimes it may also progress to liver cancer. So the hepatitis viruses are the most common causes of hepatitis in the world, but other infections like toxic substances, example alcohol, certain drugs, autoimmune disorders, they may also lead to hepatitis. 5 main types of hepatitis viruses are seen, from hepatitis A virus to hepatitis E virus, that is hepatitis A, hepatitis B, hepatitis C, D, and E. And each of them have their own unique way of infecting a human and causing an infection. So this hepatitis, viral hepatitis, is a major public health problem and is in need of an urgent response. And most of them can be prevented very easily if one takes proper precautions. Viral hepatitis caused 1.34 million deaths in 2015, and most viral hepatitis deaths in 2015 were due to chronic liver diseases. In fact, 720,000 deaths were due to cirrhosis, and primary liver cancer, which were 470,000 deaths from primary liver cancer across the world. And globally in 2015, an estimated 257 million people were living with chronic hepatitis B viral infection. So you can imagine just the volume of disease load which is there in the society. And 71 million people had chronic hepatitis C viral infection. And India lies fortunately in the intermediate zone and not in the high zone for hepatitis B. Viral hepatitis is a necroinflammatory liver disease of variable severity. And persistent infection by hepatitis B virus is often associated with chronic liver disease that can lead to the development of cirrhosis and hepatocellular cancer. Hepatocellular cancer has been found to be more commonly associated when we are dealing with hepatitis B as compared to hepatitis C. And if we look at India, hepatitis B has been more common in the Indian subcontinent as compared to hepatitis C. And young children who are infected with hepatitis A virus usually remain asymptomatic, and acute hepatitis A is more severe and has a higher mortality in adults. The incubation period of hepatitis B virus is 40 to 50 days, and on an average approximately 12 weeks, and it may be directly injurious to the hepatocytes. However, there can also be immune mediated, that is, it stimulates the immune reaction in the body, immune mediated cytotoxicity, which plays a predominant role in causing liver damage. When we talk about hepatitis C virus, again, it has a viral incubation period of approximately 8 weeks. Both hepatitis B and hepatitis C virus, they usually get transmitted by sexual contact, by sharing of intravenous needles, by blood transfusions. 15 to 30% of patients with chronic hepatitis C will experience progression to cirrhosis. Another virus which is seen, which is kind of a piggyback virus, is hepatitis D virus. And it does not an individual independently. It is simultaneous introduction of hepatitis B and hepatitis D virus in a patient will result in the same clinical picture as of acute infection with hepatitis B virus alone. And the resulting acute hepatitis may be mild to severe. And chronic hepatitis B virus and HDV disease, when both of them are present, it tends to progress more rapidly to cirrhosis than chronic hepatitis B viral infection alone. Then coming to hepatitis E virus, again similar to hepatitis A in its transmission, it is through fecal-oral route, that is through contaminated food and water. And HEV has an incubation period of 2 to 10 weeks. Acute hepatitis E virus infection is generally less severe than acute hepatitis B viral infection. What are the symptomatology? How are these patients presenting to us? So the signs and symptoms of hepatitis B virus. In this, the clinical illness is associated with the acute hepatitis B virus infection. It may range from mild diseases to a disease as severe as fulminant hepatic failure, in which there is a sudden damage to the liver, and in a span of as short as 1 week to 4 weeks, the liver may get severely damaged, even landing up with a liver transplant. So fulminant hepatic failure will occur in less than 1% of patients. Then coming to hepatitis C, and most cases of acute hepatitis C infection are asymptomatic. Even when it is symptomatic, acute hepatitis C viral infection, it tends to follow a mild course. In chronic hepatitis C, patients may or may not be symptomatic, with fatigue being the predominant reported symptom. They feel lethargic, they're unable to do their daily activity, and therefore one should screen for hepatitis, for viral hepatitis when a patient is presenting with these symptoms. The hepatitis can be difficult to diagnose because it can be asymptomatic, or symptoms may be non-specific. So non-specific or absent symptoms this is what the presentation unfortunately is in 90% of patients. So they may have a pain in the right upper abdomen, right hypochondrium, and fever. There may be nausea and vomiting, arthralgia. There may be urticaria. Specific symptoms which are present only in less than 10% of cases are mainly icterus, that is jaundice, and in the severe form they may have fulminant hepatitis. They may present with hepatic encephalopathy in a confused state. For hepatitis C, anti-HCV antibody. For hepatitis D, HDV, IgM, and antigen delta. For hepatitis E virus, IgM and HEV, IgG. And when we are talking about chronic hepatitis, for hepatitis B, again hepatitis B surface antigen and core antibody. Then hepatitis C, again anti-hepatitis C antibody, and also HCV RNA. Then for prenatal hepatitis B screening, mother should be monitored for hepatitis B E antigen and anti-HBe antibody, and newborn one should have a quantitative anti-HBs titer after vaccination. For hepatitis B vaccination, vaccinated patients, if for B, if the core antibody is negative, one should vaccinate. If it is positive, then quantitative hepatitis B surface antigen and anti-hepatitis B core antibody total should be done. And post-vaccination, one should do a hepatitis B surface antibody total. For HAV infection, patient more than 30 years, a total anti-hepatitis A virus should be evaluated, and if it is negative, one can vaccinate for hepatitis A. Thank you.